Good morning. Today's presentation would be about fibromyalgia. Good morning. Today's presentation is about fibromyalgia. Fibromyalgia is a long-term condition that involves widespread body pain and tiredness. It is more common in women than in men. Family history is a big risk factor. Person may be more likely to get fibromyalgia if the parent or siblings has it. There are other conditions associated with it, like osteoarthritis, rheumatoid arthritis, lupus erythematosus. Fibromyalgia, including pain throughout the body that has lasted for at least 3 months. Tiredness, fatigue, feeling unwell. A person may have trouble paying attention and focusing on mental tasks too. With fibromyalgia, a mix of treatment is often the best thing to work out. Medicine described to ease the pain may improve the condition. Physical therapy and counseling is very important to reduce the pain and boost the quality of life. Lifestyle changes are important. It's key to eat healthy, regular exercises, and get good enough or good quality sleep. Very common, more than 3 million in the US suffer from this. Treatment can help, but the condition cannot be cured. Required medical diagnosis, lab tests rarely required, and it is a chronic condition that could last a lifetime. Who gets the fibromyalgia? Anyone can get it, but more common in women than in men. It affects people of any age, even children, but it usually starts in the middle age, and the chance of having it increases as you get older. It occurs in all people of racial and ethnic background. The risk factor, as we said, it affects people of all ages. Most people who are diagnosed with it are middle-aged, and they're likely to get the fibromyalgia more as they get older. Lupus and rheumatoid arthritis are maybe an associated thing to develop fibromyalgia. There are other characteristics being linked to it. More research needs to be performed to confirm this relationship. These possible factors include sex. Women are twice likely to be affected more than men. Stressful or traumatic event such as adverse childhood experience, car accident, post-traumatic stress disorder, repetitive injuries or injury from repetitive stress on the joint like repeated knee bending, illnesses like viral infection, family history, and obesity. The symptoms of fibromyalgia, the main is a chronic widespread pain throughout the body or at multiple sites. Pain is often felt in the legs, arm, head, chest, back, and buttocks. People often describe it as aching, burning, throbbing, fatigue, or any other overwhelming feeling associated with it, and tiredness. Problems with sleeping. Other problem could be muscle and joint stiffness, tenderness to touch, numbness, tingling in the arms and leg, problem with focusing and concentration clearly, memory changes, what's called fibrofog, heightened sensitivity to light, noises, odor, and temperature. Digestive issues like bloating or constipation. Points of tenderness and pain could be the left upper region, like shoulder, arm, and jaw, right upper region, shoulder, arm, or jaw, left lower region, including hip, buttock, and legs, right lower region, including hip, buttock, legs, and axial, included the back, chest, and abdomen. Other symptoms include problem with thinking, memory, concentration, muscle joint stiffness, sensitivity to light. People with fibromyalgia are more likely having to have anxiety, depression, headache, including migraine, irritable bowel syndrome, and pain in the face and the jaw, including disorders of the TMJ, syndrome, temporomandibular joint. The causes, nobody knows the causes of it, but studies have shown that people with the disorder have a high sensitivity to pain, so they feel pain when others do not. Brain imaging is required. Other research have uncovered evidence of altered signaling in the neural pathway and transmission and receiving the pain in people with fibromyalgia. These changes may also contribute to the feeling of fatigue, sleep disturbances, cognitive impairment, as many people with this disorder experience. This condition run in family. There are genetic factors are likely to contribute to the disorder, but little is known about a specific gene. Researchers believe that environmental, not genetic factor, plays an important role in the risk of a person involving this problem. These environmental triggers may include having a disease that causes pain like rheumatoid arthritis, mental health problem, anxiety, and depression. The way fibromyalgia is treated, it can be effectively treated and managed with the medication and self-management strategies. You can learn about self-management strategies in the section on how can I improve my quality of life. Fibromyalgia should be treated by healthcare professionals. A team of healthcare professionals specializes in the treatment of fibromyalgia and other types of arthritis. Doctors who have a specialized knowledge about fibromyalgia include rheumatologists. Healthcare providers usually treat it by combination of treatment, which may include medication, like prescription of medication over the counter for pain relief, aerobic exercises, and muscle strengthening exercise. It has been found that there is a great relief with the use of high-impact aerobic exercises. Education of the patient, usually in the primary care or community setting, stress management technique like meditation, yoga, massage, good sleep habit to improve quality of sleep is very important, cognitive behavioral therapy to treat depression. And cognitive behavioral therapy, it's a type of talk meant to change the way people think about situations or the way they act. In addition to medical treatment, people can manage their fibromyalgia with self-management strategies as described to reduce pain and disability. The complication of fibromyalgia, as the fibromyalgia causes pain, disability, lower quality of life. In USA, the complication can be found as more hospitalization. If you have a fibromyalgia, you're twice likely to be hospitalized as someone without it. Lower quality of life. Women with fibromyalgia may experience lower quality of life. Higher rate of major depression. And people with fibromyalgia are more than 3 times likely to have major depression than adults without fibromyalgia. Screening and treating depression is extremely important. Higher death rate from suicide and injuries. Death rate from suicide and injuries are high among people with fibromyalgia. However, overall mortality among adults with fibromyalgia is similar to general population. There is a high rate of other rheumatic condition. Fibromyalgia often occur with types of arthritis like osteoarthritis, rheumatoid arthritis, systemic lupus, and ankylosing spondylitis. How to improve the quality of life? Get physically active. Experts recommend that adults with moderate physical activity, at least 150 minutes per week of walk or swimming or biking 5 days a week. These 30 minutes can be broken into 3 separate 10-minute sessions during the day. Regular physical activity can also reduce the risk of developing other chronic diseases like heart disease, diabetes. We can learn more about physical activity for arthritis. You can exercise on your own or participate in a CDC recognized physical activity program. Go to recognized physical activity program. Those concerned about how to exercise safely can participate in a physical activity program. There are specific classes that are proven to be effective in reducing pain and disability related to arthritis, improving the mood and the ability to move. Classes take place either local, like in a park or community center. Some classes are offered remotely. These classes has a lot to do with feeling better and improving self-confidence. Attend to self-management educational classes, which helps people with arthritis and other conditions, including fibromyalgia, to be more confident in how to control their symptoms. The classes also teaches on how to live better and understand how the condition can affect your life. To learn more about it, we can get to the CDC self-management educational program. The other method of improving on fibromyalgia is the talk therapy, like cognitive behavioral therapy, to help you learn strategies how to deal with pain, stress, and negative thought. If you also have depression, along with the fibromyalgia, which is highly likely, talk therapy can help with this too. With the symptoms of fibromyalgia. Researcher needs to do more studies on which one is more effective. Then mindful have some illness meditation. Biofeedback, which uses electronic devices, measure body function such as breathing, heart rate. This teaches you how to be aware of the body function so you can learn to control it. Movement therapy like Tai Chi and yoga, massage therapy, acupuncture. That brings us to the end of this presentation. In fact, this is a very wide subject. Little has been done about the studies, cause and therapy. The therapy that we spoke about does not necessarily result in complete abolishing to the situation. It can make some improvement, but it does not cure the condition. I think the cure has to come from within, that the patient acknowledge he has this problem, and this problem is caused by many factors. Most of them are non-organic, except the patient who have lupus and rheumatoid arthritis and that kind of problem. They have to change, look back at their lives, try to identify when and why this condition started, the precipitating event. Unless you cure the precipitating event or you get over it, the likelihood of success is very minimal. And then the patient, when she acknowledges the problem, she works around it and try to relieve it one by one. There is no 1 + 1 = 2 here. Exercise, no need to say, high impact aerobic has the best influence on patients with fibromyalgia. It might be difficult to get them to acknowledge that, but giving them a push to do exercises will be the start of the course of the treatment. As you know, exercises improve sense of well-being, as well as socializing, talking to a therapist in terms of the problems and the day-to-day life challenges that a patient with fibromyalgia faces. Patient needs help at home, as most of those patients are married with children and family, and having fibromyalgia have a negative effect on the family and the kids. Massage therapy, yoga exercises, Tai Chi, acupuncture, these are all associated therapy. The crux of the problem has to be treated in order to assure improvement in the case. Most of the patients have some form of problem in their personal life, and the start of developing fibromyalgia goes back to the days when they had the problem. So probing in the history and counseling face-to-face and antidepressant treatment, non-steroidal anti-inflammatory like ibuprofen help to ease the pain, and the patient is better asked to improve on social life and enjoy being part of a team and part of a group therapy. That will help to improve the situation. End of dictation. I hope this was useful.